A crucial element in health literacy is communication between our patients or clients and us as healthcare providers. Effective communication with our patients can have a positive impact on medical outcomes by building rapport and trust, reducing anxiety and psychological distress, and has shown higher rates of compliance from our patients. Clear communication is also key to shared decision-making, another topic we'll discuss in this series. Low health literacy levels is just one communication barrier that we may face when working with our patients. Others include language differences, cultural biases, a lack of trust in healthcare professionals, and unclear messaging in our materials. Let's go over some strategies that you can implement to improve the effectiveness of your communication. Listen carefully. Active listening is a communication skill based on paying complete attention to what a person is saying, listening carefully while showing interest and not interrupting. It goes beyond just hearing what they are saying. It's listening to the complete statement and picking up on their feelings. To ensure they know we are listening with care, we can ask clarifying questions or give nonverbal cues signifying that what they are saying is in fact important. Use plain language. Plain language is communication your audience can understand the first time they read or hear it. When communicating to the patient, avoid using medical terminology like hyperlipidemia, hyperglycemia, or hypertension. Instead, call it what it is: high cholesterol, high blood sugar, and high blood pressure. Refer to body parts in layman's terms, such as stomach or belly versus abdomen. If using a term is unavoidable while explaining something, gauge for understanding before moving forward with the conversation, or automatically offer up another explanation before confusion takes over. Apply the teach-back method. The teach-back method is a way of checking understanding by asking individuals to state in their own words what they need to know or do about their health. It's a tool to see how well you communicated something, not necessarily how well someone understood it. Here are some tips to ensure teach-back is successful. Focus on just one topic at a time for your teach-back. Utilize tools to aid in delivery. Graphics, posters, or models can be used to help explain what you want your client to know. Use a show me or tell me approach. Give clear instructions on what the individual is to explain or demonstrate. For example, we have changed the dosing on your high blood pressure medication. Can you please tell me or show me how many tablets you will now be taking? Clarify and check again. If your teach-back reveals a misunderstanding, explain things again using a different approach. Repeat the process until they are able to correctly describe the information in their own words. Some other strategies for effective verbal communication include slowing down while speaking, limiting the amount of information provided to only the key pieces, and creating a shame-free environment. Make patients feel comfortable asking questions. When caring for patients with limited English proficiency, consider hiring bilingual staff members or trained interpreters, or work with a telephone or video medical interpreter service for interpretation over the phone or telehealth appointments. When it comes to the materials we provide to patients, there are things that we can do to ensure they are easy to understand by the populations we serve. Provide written materials in the patient's preferred languages, and those that utilize plain language. Utilize universal visual aids to assist in communication. Posters, diagrams, models, and more can be incredibly useful. And use your resources. There are tons of guides that we can refer to when developing our patient materials. The Centers for Medicare and Medicaid Services has a toolkit dedicated to making written materials that are clear and effective. Each piece we cover in this series is meant to be a small step towards achieving a much larger goal: organizational health literacy for us, and personal health literacy for our community. As you can probably tell, communication plays such a vital role in improving health literacy. There are so many things that we can do to effectively communicate with our patients. Check out the resource links in the description below for additional information and guides.